Okay, good afternoon, guys. Welcome to this training session. This is a training session aimed at receptionists and administrators for the new patient-facing app that you have in practice now called My Surgery app. So a little bit about me. My name's Steph. I was a practice manager in a primary care centre in Swansea for about 17 years and a cluster lead. And I was quite involved with the receptions on a day-to-day basis between 8 and 10 in the morning when we've got the usual mad rush of phone calls coming in. I would also help the receptionists to answer the phone calls. So I know what kind of pressure you guys are under with regards to particularly call volumes and trying to cope with demand, really, and patients are becoming more and more demanding. We need to cope with that demand a bit better. So we've built the app to give patients a choice of how they contact you. So I'm going to share my screen now and show you the app's home screen. So hopefully you can see this to my, I think it's to my left. This will say Grange Road Surgery. And Grange Road GP cluster. So when a patient downloads the app from either the App Store, Google or Play, they get to search for their surgery. So they would look for your surgery name and they would favorite that then and say, yeah, I'm a patient here. So once they say which surgery they've chosen, then it would come to the app that we've built for your surgery. So we'd have your surgery, a photograph of your surgery there, your surgery name, whatever then cluster your GP surgery is part of. Now, there's a few buttons on the home page which we're going to go through with you today. There are some other icons on the bottom here, such as a what's on calendar. So there's a calendar here which your GP, your practice manager will access to, and it'll tell patients about when you've got flu clinic or coronavirus clinic or sexual health or diabetic clinic, whatever it is. There's also a tab for your surgery, so patients can look at and find your name and address, and they can call you from there. They can find your opening times. If you do have branch surgeries, then the information is stored here. The practice manager can put information about you guys, about the team, areas of responsibility and stuff like that. Then there's information about out of hours, a lot of stuff like that. But the home page is what is what you need to know about the most. So we'd like to go through each of these buttons with you in this training session. So bear in mind that any of these features can be enabled or disabled. So your practice manager will have access to a management portal which interacts with your practice-based app. So, for example, there's a button here now called Arrive Yourself for Face-to-Face Appointment, which basically acts in the same way as if you do have it at the moment. Patients come into your reception area and they press the button that you've got a self-arrival check-in system, haven't you? Some practices got that. If you haven't, then this will be completely disabled. But if you have got that, during COVID, it's quite difficult sometimes, wasn't it, for patients to come in and arrive themselves. They had to come to reception, then go back and sit in the car, and clinicians had to come out and call them through. So this feature is really for that. So patients can click here and exactly the same system as they would use in a reception area when they arrive themselves, but now they can do it through the app. And maybe if you are letting patients back into reception now, maybe it's a bit more privacy for patients. They don't like some have said they don't like to put the date of birth into a screen. They can now do it through the app. So again, your practice manager can choose to enable or disable this feature. It's entirely up to them. The next button is order repeat prescriptions. So if a patient clicks here, then it'll take them to this landing page. And if they already have an account for My Health Online, which is the All Wales NHS repeat prescription system, then they can just simply click here and that'll transport them then to the My Health Online login. They can either choose their language and then they can log in as they usually would. If they don't have an account already, at the moment they've got to come in to you guys and they come into reception, fill out a form, and they supply 2 forms of ID. They don't have to do that anymore. The instructions are all built here for them, so they can register for online services. So they can read the instructions and then say, yes, okay, I want to register for My Health Online. They can fill this form out and click on sign up, and when they click on sign up, their phone's camera will open up and it'll ask them to take a photo, 2 forms of ID, either a driver's license or a passport, and then proof of address, and they submit that then, and it comes through in a digital file that is sent to you securely to you guys. So the patients don't need to come into reception anymore to register for online services. They can just request and register through the app. Now, the next button is I have an admin query. Now, this is very important for you guys. As I said, we did a lot of work with practice managers and practices Wales-wide, and we looked at call types. So not all calls are the same, are they? So we looked, and about 40% of all calls coming into practice are admin related. The rest are clinical. So stuff like, can I discuss a test result? Can I request a doctor's note or a doctor's letter or continuation paper? Whatever it may be, a high proportion of your calls are admin related. So now we've allowed this button, and if the patient clicks on here, they can choose a doctor's letter. They can fill this form up, and then fill this form out, and they go through the questions we ask them, and then that's submitted by email as a form, and it'll come through to a designated email address in your practice, like inquiries at, or reception at, or admin request at, whatever email address your practice manager set up. The patients can now do this. Similar with sick note. It'll say, have you been ill for 7 days or more? If they say no, they can download the self-cert form here. They don't have to come into practice anymore to fill out the form. They can download the self-cert form through the app. If they need a self-isolation note, they can click here, and then that will take them to the self-isolation note for their country, and then they can request it there. Or then they say, yes, I've been ill for more than 7 days, and they can click what the problem is, when it needs to start, if there's anything else that can be done. So there's lots of things they can do. If they had a test result, they can select which test result they've had, ECG, CT scan, MRI scan, whatever it is. They fill out that form, and it comes through to you in an electronic format. So then you can do whatever you want with it. Then you can print it off. But the point of this is that patients don't need to do it anymore. They don't need to phone you. They don't need to listen to your answer phone message. Don't need to wait in a queue. So we get the complaints, don't we, on the news about patients can't get through to a GP surgery all the time. Well, they need to help us to help them. And if there's 40% coming through, if you could reduce that by 25%, by a quarter, imagine how much difference that would make to you on a day-to-day basis, being able to manage your call volumes better with the admin queries being taken out of the phone queue and coming through as an email form, but through the app. So whenever you are speaking to patients or on the phone or in reception, and they say, well, yes, you can request this continuation or this fit note now, but did you know next time you can do that through the app? And we'll show you in a bit then how patient can download the app. Okay, so really try and push this or promote this to patients, and it really can make a difference then to your working day. Then check your symptoms. So somebody, if you're closed and the patient just wants a bit of self-help really, and they want to check their symptoms, then this will take the patient to the NHS 111 Wales symptom checker tool. Patients can either search by keyword, or they can just scroll and look. So if I was to look on cough now, then it asks the patient 4 basic information questions, and it'll kick out the result then to say, yes, this is appropriate for GP, or no, go and see your pharmacist for this and buy some over-the-counter medication, or go to MIU, or go immediately to A&E. It does give out a result, okay? The next one then is booking appointments. Now, again, don't forget, your practice manager can enable or disable this feature. So if you're not allowing booking appointments at the moment, but some surgeries are, they allow some patients to book appointments for chronic disease clinic, like diabetic clinic, or COPD or asthma clinic. So this can be enabled, and again, if the patient clicks there, it takes them into the My Health online booking system. But again, that can be disabled by your practice manager. Okay, now the next button, I need help with a condition. So we've imported a list of much the same as the symptom checker, but a bit more in depth and a bit more localized to your surgery. So if a patient was looking to find some clinical information here, they can either scroll, or they can use a keyword search. It's much the same as you would type into Google, but this is all NHS factual based information, so there's no need to use Dr. Google anymore. So if I was to type in smoking, it would bring up the stop smoking service in my area. So I can look then, and it links to a website called Help Me Quit, which is the All Wales Stop Smoking service for patients. And I can click on that, and it'll take me to the Help Me Quit website. And it'll recognize then where I am geographically because I'm on a mobile phone. I've got location services enabled, and it says, okay, well, I'm here. And then it suggests to me, these are all the pharmacies locally to me who are offering the stop smoking service. Again, if I wanted to clear that and I wanted to go down, look and let's search for vaccinations then. Type that in and it brings up the vaccination schedule. It tells mums and dads when their babies are due, and it tells adults or anybody when they would have a vaccination. And if they want to find out more, for example, let's find out more about the flu vaccine. It takes the patient then to an NHS page dedicated to the flu vaccine. It's not a forum that a patient may search on, which a lot of patients do at the moment, isn't it? So that button is for clinical information. The last button I want to show you is community and voluntary services. So there's nothing in here at the moment, but because it would be built by your practice, but not all patients need a prescription. Some patients need a befriending service or a counselling service or a walking group or a park run group or a counselling or anything really, anything that's non-clinical and the patient doesn't need a prescription for it, then your surgery is now working in a group of clusters, and they're working with the voluntary sector, and they will input information here so patients can find that there. There's other things under here then, like latest news, and patients can find out if you've got new doctors starting or updates on anything the surgery needs to give out to patients, but they can find that here. So just a recap now then. The patients can arrive themselves. The patients can order for repeat medication and register to order repeat medication. The admin queries, they can submit any admin queries at all through the app by just clicking that button. They can check their symptoms. They can book appointments. They can search for NHS factually correct information of a clinical nature, and then they can find localized services in the area for you for community and voluntary services. So one of the things when we built the app was patients told us, look, you've got a lot of things everywhere on the internet. Can you put it in one place for us? So the app is one central focal point for them to access to get any information they want. And your practice manager will have a lot of information about how patients can download the app. I'll stop sharing my screen now so you can see me again. So they will have there are stickers you can put onto your reception counter or onto your prescription drop-off box with a QR code, so patients can scan that QR code and they can download it directly. There's a pop-up stand that you can use with a QR code again. You can put those stickers and posters into consulting rooms all over reception. There's a banner you can put on your website. There's some text you can put on your telephone line, or a text message you can send out to patients, or patients can simply go to the Google Store, Play Store, Apple Store, and type in My Surgery app, and it'll download the app and they can locate the surgery that they're registered with then, and then that will come to your surgery's home screen. So I hope this has been sort of a brief overview for you of the app. At least now you know when your practice manager is saying, look, we do have an app, you know what the app does now and how it can help patients really to access your services a little bit better, but to help them to manage how they do contact you. And hopefully, particularly the admin queries will help you a lot to manage the call volumes and hopefully reduce down how many calls you do get. So my name's Steph. If you'd like any more information, please do approach your practice manager, or we've got some more training videos available on YouTube for you to watch. But please do get in touch if you do any more questions. And thanks for attending. Thank you.